Today, we're going to try and demystify long COVID. It's this really complex and, honestly, often misunderstood condition that can affect people long after their initial COVID-19 infection has supposedly cleared. Okay, so here's how we're going to tackle this. We're essentially going to follow the patient journey. We'll start with that initial confusion, and for many, the disbelief they faced. Then we'll get into what we now understand about the symptoms and the science behind it all. And finally, we'll look at how this challenging condition is managed and how we might prevent it.
You know, for so many people, finally testing negative for COVID, well, that wasn't the end of the story at all. In a lot of ways, it was just the start of a much longer and way more confusing chapter.
And this feeling of not being believed, was incredibly common. I mean, think about this. It was actually patients themselves who came up with the term long COVID way back in May 2020. They had to create their own online communities, not just for support, but to become activists, pushing for recognition and research while the medical world was still scrambling to catch up.
A huge part of that early confusion was that there was no single clear definition. For a long time, you had major health organizations all using different names and different timelines for the same condition. And as you can imagine, that made it really tough for patients to get a diagnosis and for scientists to study it consistently.
So the big question is, who is most at risk of developing long COVID? Well, we're still learning a lot, but some of the big studies have started to show some pretty clear patterns.
Data like this from the UK's Office for National Statistics really highlights some of those patterns. You can see the highest rates are in people between 35 and 65 years old. The data also shows that women seem to be more likely to be affected than men, and, sadly, folks in more socioeconomically deprived groups also face a higher risk.
So this gives us a kind of general risk profile, right? Things like having pre-existing conditions, a really rough initial case of COVID, and being unvaccinated. All of those seem to increase the likelihood. But, and this is a huge but, these are just statistical tendencies. They are not guarantees.
And this right here is probably one of the most important things to understand. Long COVID can affect anyone. In fact, because so many people had mild or even asymptomatic COVID, the majority of people living with long COVID today, they were never even hospitalized for their initial infection.
Okay, let's talk about the experience of long COVID itself. This is a condition that can literally touch nearly every single system in the body.
One of the most common and truly debilitating symptoms is a profound sense of fatigue. But we are not just talking about being tired. This is often something called post-exertional symptom exacerbation. What that means is even a small amount of physical or mental effort can trigger a severe crash in symptoms, and it might not even happen until days later.
A lot of people also talk about brain fog. Now, that's not a formal medical term, but it perfectly describes that feeling of just cognitive slowness. It can mess with your short-term memory, your concentration, and it can make complex things like multitasking or planning feel almost impossible. Breathing problems are also really common, but they often show up in this really unique way. Patients will describe a constricting or burning feeling in their chest. Some people call it the COVID squeeze. It's this bizarre sensation of just not being able to get a full, satisfying breath.
And then, the condition can also just throw the body's whole autopilot system out of whack. I'm talking about the autonomic nervous system, the thing that controls your heart rate, blood pressure, digestion, all that automatic stuff. When that gets disrupted, it can cause dizziness, a racing heart just from standing up, and a whole range of digestive issues. It's a real mess.
So with all these crazy, wide-ranging symptoms, the huge question for scientists is, what is actually going on inside the body to cause all this? Right now, research is pointing toward three main theories.
Okay, so the first idea is viral persistence. That's the theory that little bits of the virus or its proteins are just lingering in the body's tissues and continuing to cause inflammation. The second is immune dysregulation. Basically, the initial infection might flip a switch that leaves the immune system totally confused and overactive, so it starts attacking the body's own cells. And third, there's the idea of inflammation and tiny little microclots in the lining of our blood vessels, which can mess up blood flow and oxygen delivery all over the body. And here's the thing, these probably aren't happening on their own. They could all be connected, feeding into each other in a pretty vicious cycle.
So, if that's the complex science, how is the condition actually managed right now? Well, there's no single cure just yet. So the approach is really all about supportive, personalized care that's tailored to whatever symptoms a person is dealing with.
And even though there's no cure, managing the condition effectively really boils down to two absolutely crucial principles.
The first one is called pacing. Now, this is so different from traditional rehab, where you're always told to push through it. With long COVID, that can be incredibly harmful. It can actually make symptoms way worse. Instead, patients learn to carefully manage their energy budget. They have to prioritize, plan, and pace every activity to avoid triggering one of those post-exertional crashes.
The second principle is all about providing targeted support for specific symptoms. So that can mean things like breathing exercises for respiratory issues, or something called olfactory training, which is basically smell therapy to help get that sense of smell back. It could be using to-do lists to manage brain fog, or even wearing compression garments to help with that dizziness you get from standing up.
Okay, finally, let's look ahead. What can we do to actually prevent long COVID, and what does the path forward look like from here?
This right here is the critical point. Prevention is by far our most powerful tool, and this number is just so significant. A major analysis of all the studies found that getting 3 doses of a COVID-19 vaccine cut the risk of developing long COVID by nearly 70%. That's huge.
And of course, the most foolproof, 100% effective way to prevent long COVID is to just not get COVID-19 in the first place. And that really brings home how important those public health measures still are. Things that reduce transmission, like improving the air quality inside with better ventilation and filtration.
We'll end with this question. Long COVID has been called a mass disabling event, and it has absolutely forced the world to finally pay attention to the devastating long-term consequences that can happen after a viral infection. The incredible scientific and medical focus it's getting now could fundamentally change how we understand and treat not just long COVID, but all post-viral conditions for generations to come.